Hello, Ms. Krusek. How are you today?
Good.
Good. My name is Evelyn. I'm going to be your nurse.
Mm-hmm.
Can you tell me your name and date of birth?
McKenna Prysock, 7/1802.
Perfect. Privacy. So today I'm going to be giving you your physical exam. Do you know where we are at today?
We're at a hospital.
Perfect. And what year is it?
2022.
Alrighty, perfect. So I'm going to have you follow some verbal commands. So can you stick your hands out by your side? One at a time, point your nose to your finger to your nose. Alrighty, so patient is awake, alert, and oriented ×3, and she's following verbal commands. No slur of speech or anything like that. So now I'm going to do my hand hygiene before we get started. Alrighty, I do want to let you know that everything we talk about today will stay confidential between you and I. And then if you ever feel uncomfortable or anything during the exam, you have the right to refuse, so just let me know.
Okay.
Okay, so first I'm going to start with your eyes. Use my pen light. Can you look at me, please? I'm going to measure your eyes. They're 4 millimeters. So can you look at my nose? I'm going to check the constriction. Alrighty. Consensual light constriction of both eyes. Next, I'm going to check for accommodation. So I'm going to have you look up here, and when I say so, just follow my pen. Okay. Perfect. There's accommodation, so eyes are symmetric. They're round, equal, reactive to light, so I can document Perla. And next, we're going to do the Snellen chart, so if you can follow me outside. Alrighty, I'm going to have you stand here. So I'm going to start off with you just looking with your both eyes.
Okay.
Can you start reading line 4 for me?
LPED,
Alrighty, 5.
PECFD,
Perfect.
EDFCZP, FELOPZD, DEFPOTEC,
Alrighty, can you cover your right eye, please? Start at line 6.
EDFCZP, FELOPZD, DEFPOTEC,
Perfect. Cover your other eye, please, and start at line 6.
EDFCZP, FELOPZD, DEFPOTEC.
Perfect. So patient has 20/20 visions in both eyes and doesn't have any corrective lenses or anything like that. Perfect. So now I'm gonna inspect your ears. So if I can, I'm gonna pull back your hair and look. Alrighty, look at the other one. Look straight at me, please. Ears are symmetrical on the head. It is lined up perfectly with the outer canthus. There is no lesions, discharge, or anything present on the external ear. Alrighty, next we're gonna look at the nose. So look straight ahead at me. Nose is symmetrical within the face. There's no masses, swelling, or bruising present. Next, I'm gonna look at the turbinate. Perfect. They're patent. And there's no discharge or swelling in there. So now I'm gonna look at your mouth. So can you give me a big smile? Alrighty, can you open your mouth, please? All teeth are present. Buccal mucosa is pink. Top, there's no lesions. Can I look under your tongue? No lesions under the tongue. Can I see your gums? Perfect. No gingivitis or anything like that. Can you stick out your tongue and say "ah," please? Perfect. No tonsils, so it's a grade 0. Alrighty. So this is the part of the exam where I test your gag reflex. Would you like me to do that? Alrighty. So in a real case, if I were to test the gag reflex, I would get a tongue depressor and press it on the back of their tongue, and the patient should gag. So next, I'm going to look at your throat. Throat is symmetrical, no bumps, masses, or anything present. Inspect for pulsations. I don't see any pulsations. So now I'm going to do your carotid. Do that one at a time. 2+ grade on the left side. 2 plus on the right side. I'm gonna now listen for bruits using the bell of my stethoscope. Can you hold your breath, please? Perfect. Can you hold your breath? Perfect. No bruits present. So now I'm gonna have you sit up while I look on your back. Alrighty, so the back, I'm inspecting. No redness, everything's even. There's a mole on her left shoulder. I'm now gonna palpate for tenderness. So if there's any tender parts, please just let me know. Is anything hurting you? Perfect. So now I'm gonna listen to the breath sounds, starting at the apices at the top. Alrighty, breath sounds are clear. Next, I'm also gonna check for your kidney, so you can just back up. Sorry about that. So I'm gonna palpate. So if you feel any tenderness, just let me know. Nothing? Okay, you can lie back down for me. Okay, so next I'm gonna look at your chest, the front side of your chest. Move your hair. It is even and symmetrical. No redness or anything that I see present up here. Breathing is symmetrical. You're not using any accessory muscles to help you breathe. So now I'm gonna listen. Starting at the apices. Alright, if you can. Thank you. Perfect. So now if you can just lay back, I'm going to count your respiratory, so just lay back and just breathe normally. Alrighty, in 15 seconds, there's 4 full respirations, so I'm going to times that by 4. 16 respirations per minute. So next I'm going to listen to your heart. So I'm going to start off with the diaphragm. Start the apical. S1 and S2 present. Pulmonic. S1 and S2 present. You can lift them, please. Listen for the tricuspid. Alrighty, mitral. S1 and S2 in both. I'm gonna flip it to the bell. Work my way backwards. S1 and S2. S1 and S2. S1 and S2. S1 and S2. So now I'm going to listen to your heart rate and count. Alrighty, so it's 16 and 15 seconds. So 16 times 4, 64 beats per minute. Alright, so next I'm gonna have you sit out and I'm gonna test your range of motion and grip strength. So first I'm gonna test it in your hands. So if you can squeeze my hands for me. Alrighty, that's a 5. And if you can, try and spread your fingers. 5. Now I'm gonna test your wrists. So up, down, side to side. Perfect. And then can you have your arms up and then pull towards you? Alrighty, push. Alrighty, that's a 5. Shoulders, lift up. Perfect, that's a 5. And so now I'm also gonna have you, for your elbows, do supination, pronation, and then for your shoulders, you lift it up to your head, down, forward, and then as far behind you. Alrighty, full range of motion in the upper extremities. All parts of the body is graded out of 5. Alrighty, so now I'm going to have you lay down and I'm going to check your abdomen. So as I'm inspecting that abdomen, there's a birthmark in the right upper quadrant. Everything's flat, smooth. Yep, everything's flat, symmetrical. The umbilicus, there's no lesions or hernia or any discharge in that area that's present. So now I'm gonna listen. Start in the right lower quadrant. Vowel sounds are normoactive in the right lower quadrant. Normoactive in the right upper quadrant. Normoactive in the left upper quadrant. Normoactive in the left lower quadrant. So next I'm going to do palpations. So I'm going to start with the light and then go to deep. Okay. The light one, circular motions. Feeling for any tenderness or masses. So if anything hurts, just let me know. Right now there's no tenderness present. I don't feel any masses. Alrighty, I'm going to go into deep now. Alrighty. Everything feels good. Perfect. So now I'm going to look at your pulses. So first I'm going to start off with the radial. Right there, equal bilaterally, 2+, brachial, equal bilaterally, 2 pulse, 2+. Next I'm going to check the capillary refill in your fingers. Alrighty, they all came back in less than 2 seconds. So now I'm gonna ask, this is the part where we do the femoral pulse. Would you like me to do that today or no?
No, thank you.
No, so the way I would do that is I would feel for the pulse in the groin area, make sure it is even, and it is like a 2 pulse, 2+ pulse. But another way to make sure that is good is to check the lower extremities. So that's what I'm gonna do next for the pulses. Next, I'm gonna check the back of the knees. Pulses are equal bilaterally, 2 pulse, 2+. Alrighty, equal bilaterally, 2+. Equal bilaterally, 2+. Alrighty, so since these were good, I know the femoral pulse is good. Now I'm gonna do capillary refill, the toes. Alright, they all came back in less than 2 seconds. So as I'm inspecting the legs, there's no redness or patches of different colored skin. There's a couple bruises on her shin. I'm gonna feel the temperature with the back of my whole hand. Her skin is cool. It's not wet or anything like that. Can you sit your feet up a little bit so I can look for any varicose veins? No varicose veins are present on either side. And sit it down, put your legs back down, please. Test for edema. No edema present, a grade 0. Now I'm going to inspect in between the toes. Alrighty. And the soles of her feet. Perfect. No abnormalities, lesions, or any blistering in her feet. And the hair distribution on the leg, there's no hair. So next I'm going to do the range of motion for the lower half. So if you can, put your knee to your chest one at a time. Good, now put it to the side. Good. If you can you sit your legs off the edge of the bed? Alrighty. I'm gonna have you pull your legs towards you. It's 5 out of 5. Push. 5 out of 5. Push down. Good. 5 out of 5. 5 out of 5 and push up. Good. 5 out of 5. So now I'm gonna have you pull one leg off the bed at a time. Good. Can you cross your legs? Good. And then your ankles, can you move them up, down, in and out? Good. And can you wiggle your toes for me? Perfect. I'm gonna have you stand up now. I'm gonna check your spine. You bend over. Alrighty, everything is straight. Shoulders and hips are even. So now another test for your spine. You can turn around. You're gonna move forward, back, side to side. Alrighty, spine has full range of motion. And then next I'm going to evaluate your gait. So if you can stand right there and walk towards me. And then turn around and walk. Alrighty, gait looks good. She's not limping or anything like that. She can have a seat. Alrighty, I think that's about it for our physical examination today. Do you have any questions for me? Alright, thank you.